Thank you for taking a few minutes to view this video explaining treatments we use at Olympic Spine and Sports Therapy. Hi, I'm Dr. Mark Shelley. I'm a chiropractic physician and board-certified functional neurologist. I'm also the clinic director here at Olympic Spine and Sports Therapy. Most patients we see have lived with their pain and limitations for a long time. They've been to a number of doctors and had all kinds of tests performed without finding lasting relief. Chronic pain can be extremely frustrating and debilitating. It wears on you physically and emotionally. I've seen it cost patients their jobs, prevent them from enjoying activities they love, strain relationships, and worse. That's the bad news. The good news is that we've helped thousands of patients find lasting relief and regain their ability to do the activities they enjoy. We've done it without subjecting our patients to the risks and side effects of drugs, injections, or surgery. All of our treatments are safe, effective, and pain-free. Over the next several minutes, I'll walk you through each of the therapies we use to help you understand how the treatments are unique, comprehensive, and effective. Comprehensive treatment plans frequently include combinations of the following therapies. High-dose laser therapy. Often when people hear the word laser, they think about ones used for surgery. We don't use lasers that cut, we use lasers that heal. Our body can benefit from absorbing certain frequencies and wavelengths of light. Similar to the way plants can absorb sunlight and convert it into energy for growth, our body can absorb near-infrared light and convert it into ATP. ATP, or adenosine triphosphate, is the energy currency of the cell. So higher levels increase the fuel available for cell function and can increase the rate of regeneration. In our experience, high-dose laser allows us to use more powerful therapies so we can get results faster. The fact that laser reduces inflammation and pain, so you feel better, is really a nice secondary benefit. Non-surgical decompression therapy. Although decompression therapy is best known for treating back and neck problems due to herniated or degenerative discs, it also can be highly effective for chronic joint pain conditions. Knee and hip pain, as well as hand or arm pain due to carpal tunnel syndrome, can benefit from non-surgical decompression. These joints are similar. They're classified as synovial. That means they're encapsulated by ligaments and filled with synovial fluid. With decompression, the ligaments are gently stretched. This creates a pumping effect. To demonstrate, I'll use this model of a knee joint. You can see the internal structures, like the meniscus and the ligaments, because the capsular ligament has been removed. The capsular ligament surrounds the entire joint, so when the decompression machine stretches the joint, it creates a vacuum. The negative pressure draws water and nutrients into the joint, and the pumping effect helps to remove waste products that reduce inflammation. Decompression is not traction. Hanging upside down may stretch the joint, but it doesn't produce the pumping effect. With sophisticated decompression machines, we control the rate of application of the force, the maximum and minimum force, the frequency of the cycle. All of these combinations can be adjusted. In combination with our other therapies, decompression can be a game changer for chronic joint pain. Chiropractic adjustment and joint mobilization. First, let me set your mind at ease. We don't use forceful manipulation for chronic joint problems. If the picture that comes to mind is a doctor forcing a dislocated joint back in place, I want you to know we don't do that. We often use gentle joint mobilization or low-force instrument or table adjustments. They should be virtually pain-free. If any treatment causes pain, we don't use it. Let me explain one of the benefits of adjustment and mobilization. When a joint is injured or degenerates, often scar tissue forms in the muscles and the ligaments around the joint. These are called periarticular adhesions. The scar tissue can limit motion and alter loading patterns, creating more degeneration and pain. Often, adjustments and mobilization can stretch out and release these adhesions. Infrared light therapy. My classes in functional neurology stress two components that are essential for healing to happen. They emphasize the necessity of having fuel and activation. Glucose and oxygen are the fuel for our nerves. Activation is exercise. Infrared light therapy helps to feed the nerves and muscles by improving circulation. Research has shown that infrared therapy increases the production of nitric oxide. This in turn can accelerate the repair of blood vessels and nerves. Studies using infrared thermography demonstrate an improvement in circulation for 2 to 3 hours following a treatment. Infrared therapy is typically applied using pads to surround the joint. Treatments are pain-free. The only thing patients feel is a relaxing warm sensation. This makes infrared therapy a favorite treatment for our chronic joint pain patients. Trigenics manual therapy. Trigenics is also known as myoneural manual medicine. Myo for muscle, neural for nerve, and manual for being performed by hand. Trigenics, as the name implies, consists of 3 procedures: resisted exercise, nerve receptor activation, and a neurologic breathing technique. Trigenics retrains the way the nervous system controls muscles associated with a joint. It can reduce pain, improve motion, and restore strength and stability. Often the results are immediate and dramatic. Before I demonstrate a Trigenics treatment, I want to explain how it works. When an injury occurs, our body goes into a protective mode. For example, if you sprain an ankle, it will swell up and the muscles surrounding it will splint. They tighten up to protect it from further injury. This is an appropriate and necessary initial response. However, if the muscle contraction persists after the injury is healed, it can allow an acute injury to progress into a chronic degenerative condition. The same process can occur as a result of repetitive use from chronic postural stress. So you don't have to have an injury to get chronic joint pain. Regardless of what caused the imbalance, the solution is the same. Joint motion and stability must be restored. Trigenics accomplishes this by retraining the way the nerve system controls the muscles associated with the joint. Trigenics is not a soft tissue technique. By that, I mean it doesn't break up or stretch out scar tissue in the muscle. Treatments are applied to accomplish one of 2 objectives: to either lengthen shorten muscles or to strengthen weakened muscles. Treatments work by changing the neurologic integration of the muscle. The lengthening treatment changes the length-tension ratio in the muscle. If you'd like to learn more about this, you can Google topics like intrafusal and extrafusal muscle fibers and alpha-gamma coactivation. I wanted to talk about these, but my producer told me you would fall asleep if I did. A treatment begins by examining the length and strength of the muscles associated with the joint. Those findings are noted, patterns are evaluated, and from this, a sequence of treatments is determined. As an example, I'm going to demonstrate the 2 treatments that are frequently used with a chronic shoulder condition. I'd like to introduce you to Judy. Judy is one of our all-star patients. She came to us with a laundry list of different symptoms, neck pain and low back pain. On the top of the list, although today she's telling me she has some right shoulder problems, her left shoulder was a real trouble spot for her. So with the treatments that we've used, we've focused on that left shoulder and using the Trigenics procedure to work to restore motion, to restore strength and stability. Judy has made huge improvement from where she started. Intentionally for this video, I didn't let her get treatment for the last, week or 2 weeks or something. She's a little unhappy with me about that, but it was to be able to demonstrate what the Trigenics procedure does, how the treatment works. So Judy's assessment, we found consistently restricted motion in certain planes with her left shoulder, and we're going to demonstrate that next. So Judy, what I want you to do is raise this right arm up for us. Good, so her good arm, if you will, and down, and then do the same with the left, but stop where it gets tight or painful. So we're losing maybe 45 degrees of motion on that. You can bring that back down. Judy, let's do this. I want you to swing around and face towards me. We're going to check motion with you reaching around like you're trying to scratch your shoulder. I want you to do that, the right side first. Now, I'll have you note how high she's able to get on that. Judy, bring that down, then come around with that left one. And you can see that's probably, 3 inches difference on that. That's contraction in these muscles on the left side. Last test, actually, Judy, I'm going to have you swing back around to this side for us. Those are assessments for decreased length of muscles. I want to demonstrate also reduced strength because of the shoulder problem. One of the things we found on her initial exam was weakness in the bicep long head muscle that runs here. So Judy, push up into my hand. Judy is strong. You don't want to mess with Judy. She's strong on the right side, pushing up, but on the left side, not so much. Okay, so we've identified specific muscle groups that we want to lengthen, specific muscle group, in this case the bicep, we want to strengthen. So we're going to start with our lengthening procedure. Judy, I'll have you swing around so your knees are on that side. So we're going to be working on lengthening her latissimus dorsi. I'm actually going to get in and work on her teres a little bit today too. Perfect. Judy's holding on to the side of the table. Trigenics, as I said, 3 procedures. We're working with resisted exercise. We're using nerve receptor activation. And the third component is a breathing exercise. So Judy is going to make a S sound. We want her exhaling the whole time that we're applying the treatment procedure. That shifts her neurologically into a parasympathetic state instead of sympathetic. What we don't want her doing is holding her breath while we're doing the treatment. So Judy, I'm going to have you take a deep breath in and give me S as you push down into my hand. Perfect. Hold that pressure. That's just right. So I'm working on points in her latissimus dorsi and relax. Good. And I'm going to stretch. And in her teres muscle. Take a deep breath. So Judy is pushing down into my hand with her elbow, contracting the muscle, and relax. And then I'm stretching it. Again, breath. Great, Judy. Hold that for 3, 2, 1, and relax. So activating the nerve receptors in the muscle, contraction, stretching. We're going to retest what that did for our length, but before we do, we're going to do our treatment to restore the strength of that bicep muscle. So Judy, let's have you stand for us. And I'm going to have you stand right next to me here. Perfect. So this one, Judy is a pro at this. We're going to keep those fingers open. Again, you're going to be pushing and you're going to rotate out when we get to the last. So for this procedure, the Trigenics strengthening procedure, strangely enough, we're going to have her use the opposite muscle, what's called the antagonist. So Judy is going to be firing her triceps muscle, which is extending her arm, while I'm working on the biceps muscle, particularly on the insertion points that are probably tender. Okay, I'll stop that. Deep breath. And start that twist. Excellent. And breath, and good. And twist, and twist, and twist, and relax. You doing okay? Uh-huh. One more. Judy will tell you that this is not fun. Good. But it is effective, huh?
Yes, absolutely.
Okay, so there's our lengthening and our strengthening Trigenics procedures. Now we're going to retest and see how we did. Judy, I'll have you take a seat. And as you did before, so this right side, I want you to give us adduction. Free it easy. And left side, look at that, she comes to her head. Beautiful. Let's demonstrate that. It's called scratch test too. I'm going to have you swing around. We'll go back and forth a little bit, but I want to do it in the same sequence. So your right side, again as before, straighten that thumb out for me. There we go. Great. And down. And now let's see how we did on the left side. And I'll move the crease in the shirt, probably within 1/2 of an inch. So nice gains in our motion. Now let's see how that did for strength. So I'm going to have you swing around one more time to this side so we can test your bicep. So you are there and you're pushing up. Again, really strong. And pushing up. And Judy now, really strong. Yep. So that's something you can't really see. It's something you more have to feel. That was a marked difference, wasn't it?
Absolutely, yeah.
Yeah. Judy, thank you so much for being willing to come and let us demonstrate. The reduction of pain, compression, and inflammation is always our first priority. This is represented by the red columns. Once the pain is reduced, we can reactivate muscles that were shut down due to pain. Pain produces what is called neurogenic inhibition. When an area has been injured, the local muscles become weak and short. Local muscle contraction reduces motion, producing a splinting effect to the joint. Additionally, the force the muscles can generate from contraction is neurologically limited. This is to prevent additional injury. This is beneficial directly following an injury. However, once the pain has been reduced, these neurologic restraints are no longer necessary. To promote recovery, we gently re-engage or reactivate the local muscles. For example, a reactivation exercise for chronic knee pain is a quad extension. Simply straightening your leg, contracting your thigh muscles, helps to re-engage them. The reactivation phase is demonstrated by the gold columns. Once the muscles are back online, reactivation exercises should give way to more advanced functional therapies. These are indicated by the green columns. Initially, functional exercises are used to retrain proper joint motion and muscle activation sequences. That's the order muscles fire in to produce smooth, coordinated movement. When relatively normal joint motion is possible, the patient can be progressed to force control training. The goal here is to train your body to be able to cope with real-world dynamic environments and ultimately build endurance. Endurance can be defined as control over time. It must be dynamic to fit our real-world requirements. To develop control and endurance, we use balance-challenging devices like wobble boards, foam pads, and BOSUs. You're probably familiar with those rehab devices. You're probably not familiar with a highly effective device called a center force bar. The center force bar is a tube that has balls inside. When you move the tube, the balls roll, and this changes the force transmitted into your arms, spine, and legs. This creates continuously variable force that requires dynamic stabilization of the joints. If you'd like more detailed information about integrated functional rehabilitation, you can find it on our website. Individually, these treatments often produce impressive results, but in combination, the results can be truly amazing. Aristotle said it this way: the whole is greater than the sum of its parts. There's a synergy created by combining these therapies. It has the effect of multiplying the benefit of the treatments. Simple conditions often will respond to simple treatments. Complex conditions often require comprehensive treatment. That's why we provide the broad scope of treatment we do. Most patients that come to us have tried medication, injections, and physical therapy. Some have even tried surgery or stem cell injections and didn't get the results they were looking for. Of course, getting treatment before the condition has progressed too far is critical. There comes a point when the degeneration is so severe, surgery may be the only option. That being said, we have helped thousands of patients find relief and regain their quality of life. That includes hundreds who were told surgery was their only option. We've done that without drugs, injections, or surgery. It seems like every week we hear patients say things like, "I wish I'd learned about your office sooner." Yes, you can live with chronic pain, but why? Chronic pain robs people of their quality of life. Our comprehensive treatment approach helps people regain their quality of life. We do that by using treatments that reduce pain, heal and rehabilitate damaged tissues, and restore strength and stability. Treatments that are safe, effective, drug and surgery-free. If you're tired of living with pain and the way that it limits your life, call us and schedule a free consultation. Thank you, and please feel free to reach out to us directly if you have any questions regarding the content of this video.